Welcome to Session 1 Review. And since most of you have already asked the questions that you have, I'm going to go ahead and talk briefly about what to expect this week. For those of you who just finished Session 9, you're going to find Session 1 a welcome relief, mainly because it's so easy compared to Session 9. In Session 9, what you had is you had the gamut of tasks involved in the revenue cycle. And there was a lot of work. There's a lot of tasks, and I have to say that most of you are doing a really good job. I did want to explain to you that because of time limitations, it's not always possible for me to grade your assignments that week. I simply do not have that time allotted to me, but I do go back and I look at the grades, look at your work in detail. And if I find that there's something that you may not be seeing or doing the correct way, I will give you feedbacks, and you should get an email once I check your grade or I make a comment about what you've submitted. You should get an email that something has been posted, and always check that to make sure, just in case. So compared to last week, this week is going to be easy because this week is Session 1, and this is the session that if you were actually getting on this ride at the beginning of it, this is where you'd be starting. All right, so for some of you, this is your second, third, fourth, fifth session, and compared to the tasks that you've been doing, which is essentially the complete revenue cycle, this is going to be very easy because this begins at the beginning of what you would be doing in a medical office. If a new patient calls for an appointment and you had to do insurance verification and some of the preliminary steps involved, not only insurance verification to make sure that the patient is eligible to receive services from your network physician, but is also in one case where you're going to actually not only are you going to verify benefits, but you're also going to do get a pre-authorization for services. You're going to practice that. The only thing that we have available for pre-authorization with the materials and resources that we have is going to be a combination of work that you may have already done excuse me, that you may have already completed in your Fortneys. If you've already completed this work, then the only thing that's going to be left for you to do is actually write the assignment out on a Word document. But I think in most cases we'll be able to work this out because you still have the basic information that you need. So what I need is a thumbs up from everybody who has worked in their Fortneys insurance handbook in this one. Except the difference would be the workbook that you're using. Excuse me, I'll need a thumbs up for those of you who have done work in the Fortneys workbook. I don't see a lot of thumbs up. Okay, so what that means, hi Ashley and Gustavo. So what that means is for those of you who have not done work in the workbook, a little surprising, but that means that you'll probably have the resources available and you won't have to recreate them on a Word document. So this is what we're going to be doing for Session 1. You're basically going to do health insurance verification. You're going to do authorization for services. The bulk of your work is going to be coding reports. Whereas in the past several sessions, you've had about two reports per module to code. This Session 1 is heavy on the report coding side. I think you have probably over 10 reports to code, so put your thinking cap on and be prepared for this. Thumbs up if you did the reports for last session. If you've been doing the reports, okay. So this time, so you're going to be doing coding ICD-10 and CPT coding of reports, and most of you are familiar with that. And you're going to be completing a YouTube video on the verification process. As usual, there is some guidance on every YouTube video that you have to do that is embedded within each session. And consistent with that is a YouTube video that walks you through the verification process. So essentially, the purpose of creating the YouTube videos is really based in the environment that we're working in now, which is virtual. And in the event that the theory behind it is that in the event we get a request for a student to come on site or for a job interview, if they request it, so far, in the whole time I've been doing this since March or April, so far, haven't had one single request, but this is still something that is required. In the event a request is made, we will offer them the YouTube video. And along those lines, I want to remind everybody that you have to dress professionally when you do the YouTube video, even if it is just the top you're wearing, which is all anybody is going to see. I have my regular civilian clothes on. When I'm working, I put my smock on, my cover. All you have to do is put your uniform top on when you're doing the YouTube video. If you don't, I have to take points off. You get credit for submitting it, but I got to take points off. Not that that matters in the long run. So just want to remind you about the attendance requirements. All assignments are due Thursday by 11:59 p.m. All assignments, every single Dropbox has to have an assignment in it weekly by that time, and you have to be at the review. Someone needs to, you have to be at the review as you are present today in order to get full attendance credit. Does anybody have any questions so far? Okay, so without further ado, I'm going to go ahead. Can you see the opening page for session 1 right now? Thumbs up if you can. Should be able to. Okay, good. Got it? Good. All right, so I want to review just a few things with you. One of them is to always, as a reminder, what I put in session 1 is an overview and instructions for just an overview of the layout of the course or the sessions, and particularly this session, and instructions on how to submit your assignments, just as a reminder. And in addition, one of the things that I'd like to remind you of is every week you should always base your work based on the checklist. As you can see, this checklist is relatively small this week because it's not as involved as the previous weeks that you've done. So as a reminder, if you ever have a cloud in your mind about where to start, all you have to do, I've tried to make it as easy as possible for you to stay organized. All you have to do is go to the session that you're in and look at the checklist of activities and start from 1 to 7 and then review the objectives. So in this case, number 1, this number 1 activities is for the new students only. Those of you who are in the review right now have already worked this out. All right, most of you, if you didn't have it, you now have access to it, right, Jackie? Good. I read your lips. I know you said yes. Good. So the first on the checklist is usually addressed to the new students. The rest of them tells you exactly what you need to do to make sure you stay on track and that you've completed everything. So for this week, the first thing that you're going to do is review the video that's here on eligibility. All right. And then the second thing that you would do would be to complete the prior authorization assignment. So let's go down to where the prior authorization assignment is, right here. It's not at the top. I might actually move it to the top, but right now it's right here. And in this case, for session 1, the directions for the assignment are housed, and oftentimes they are housed in the Dropbox section itself. So you would click on the prior authorization assignment, as I'm doing, and then you would make note of the directions. And this is where your workbook comes in. So I'm going to read this. For this assignment, you'll need to reference patient record number T4 Jennifer Lacey in Fortney's Medical Insurance 14th or 15th edition. This one I have is the 15th edition, but it's still the same work product, and I have it marked in my book. I have a couple of things marked in my book. At the back of your workbook, what you see toward the back in the, it actually says, it's entitled Tests. So make a note that it says Tests. And it looks like this. I'll open up. It's this chapter that looks just like this. Okay, for those of you who can see it. It says Tests, and it's in the back of your workbook. In the 15th edition, This page starts on page 318. Okay, so make a note. But you won't start your work on page 318. In the 15th edition, and I don't have the 14th edition, but it's essentially the same work product. In the 15th edition, it's on page 334 that you would see patient record number T-4. Okay? So in order to complete this assignment, you're going to have to do some workarounds. You'll need T-4, but you will also need, in the 15th edition, most of you have the 15th edition. In the 15th edition of 4D's workbook, you will also need to reference the beginning of college clinic office policies and mock fee schedule on page 361. And there it is, Appendix A. And this is what you'll be using to get the basic information that you need about the doctor that you're billing for, that you're requesting the authorization for, about the clinical information such as the CPT codes that you might be billing for. Take a look when you get a chance at Appendix A, especially the fee schedule, because this is something that is common to all medical practices, especially if they're group practices. You have a group of physicians, and all of those physicians are going to require bills to be sent out. And in order to identify the physician within that clinic who is actually providing these services, you need specific information that is given to you in the fee schedule. And that information is the name of the doctor, their specialty, a mock Social Security number, a mock state license number, a mock employee ID number, and a mock Medicare assigned national provider number, NPI. And this is good for you to become acquainted with, because this is something that you will often be using when you're in the field. In addition, on page 369 of the workbook, page 369 of the workbook, you'll see the beginning of the detailed mock fee schedule, in which you see a listing of the CPT codes, their descriptions, and their fees. And this is something that you're going to need to actually do the authorization. So what I'm going to do is I'm going to do a brief walkthrough of this scenario. This scenario is not described here. This is a created scenario that you're going to use Jennifer Lacey to carry out the task, okay? The scenario is that Jennifer Lacey was referred to Dr. Bertha Caesar. Jennifer Lacey is a patient in your workbook, and Bertha Caesar is a doctor in your workbook, okay? Jennifer Lacey was referred to Bertha Caesar by her primary care physician, Dr. Cutler. Miss Lacey's initial visit to Dr. Caesar was on August 1st, 2020. At that time, the patient complained of irregular menstruation and a feeling of fullness in her lower abdomen. She also brought with her the results of a previous ultrasound, which showed leiomyomata uteri and right ovarian mass. After completing a history and examination on the patient, Dr. Caesar determined that the patient should be scheduled for an abdominal hysterectomy with bilateral salpingoophorectomy. The surgery will be scheduled at College Hospital for August 3rd, 2020, or let's just say 2020. The patient will be admitted to the hospital on August 2nd. And if all goes well, Dr. Caesar anticipates the patient will be discharged on August 7, 2020. And you have to obtain prior authorization for this surgery using the prior authorization request form supplied here. And this is the blank form. I'm going to go ahead and open it up. Okay, and let me just move. I'm going to move to a few some information now. Make a note here that if you are when you open to patient record T4 on page 334, you will see on the adjacent page, if you open that up now, you can do this with me. You'll see on the adjacent page the progress notes related to this case, and for which I made a summary. So take a minute to look at that while I open this up. Okay, so this is, and I know how challenging this is for all of you. What I had to do is I ended up scanning this, but nonetheless, this is the prior authorization form. And I'm going to try to just see something here. Okay, that's too big. I'm going to go ahead and shrink it. Let's see. This says best fit. So I'm making it as large as I can without compromising everything. But as you can see, what this is essentially, this is a prior authorization form that you'll need to complete for this patient. You're going to have to put her name, and we have that. Everything you need to complete this form, you have in this patient record and in the notes. The name, the gender, the date of birth, all of the information, the primary care physician, the referring physician, that information I've supplied for you in the basic summary, but it's also on the patient record. And the address of who the patient is referred to. This is very much like what you'd be doing in the setting, in the actual formal setting of a physician's office. The diagnosis code, any diagnosis codes related to this prior authorization. Now, if you reference, I'm going to move this out of the way. If you reference here, you see what I'm pointing to, bilateral salpingo. Oh, that's a surgery. Sorry about that. What the patient has is leiomyomata uteri. You can actually, and a right ovarian mass. So this patient actually has two different diagnoses. It's up to you, coders and billers, to locate the ICD-10 codes for these codes. It's up to you. So you would indicate the diagnosis codes, but you would also indicate the procedure codes. Where you would find you would reference, again moving this out of the way, you would reference abdominal hysterectomy with bilateral salpingoophorectomy, are the procedure codes, and where you would find these is on the fee schedule in Appendix A of your workbook. And again, and I just lost my page, didn't mean to do that. I'm going to find it again in just a minute. Appendix A for the fee schedule actually begins where you would be concerned. Not sure why. For all intents and purposes, you would begin looking for this particular procedure code, okay, at the beginning of the fee schedule, which starts on page 369. So what you'd have to do is go to, and I can actually kind of help you with this. You would begin looking for this particular code under surgery. The surgery codes would actually begin on page 374, but that's not where you're going to find this code. This is just where they begin. You will do a search for this particular, either you use your SimChart True Code to look up the CPT code description for the surgery, which again is going to be abdominal hysterectomy with bilateral salpingoophorectomy. You can Google the CT code, but you have to double check it to make sure that it is the correct code. I can tell you that the CPT codes for the genitourinary system in your fee schedule are going to start on page 377. That's the biggest hint I can give you. So write it down, okay? And from there you will have to locate the description of the CPT code or locate it otherwise. But what you cannot Google is the fee for this. And what I'd like for you to make a note of is that the mock fee, the fee that you would use would be the mock fee. Don't use the Medicare fee schedule. Does everybody know what I'm talking about? If you turn to page 377 in your workbook, what you'll see is you will see the code descriptions on one side in one column, and then on the other column you'll see a Medicare fee schedule. What I need you to use is the column on the left side, and the fee that I need you to use is a mock fee associated with the CPT code that you're going to be coding for. Okay, and let's see, yeah. And this code is there. These two codes are there, and if you take a minute to look for them, you'll find them very easily. I gave you a big fat hint as to where to find them. So essentially, you complete this authorization form, print it up, complete it, and if you don't have a scanner, take a picture of it and upload it. I understand from one of my students, although I cannot give you direction on how to do this, is if you have an iPhone, you can actually create, you can download an app where you can create a PDF out of the photos that you use. But even if you can't create the PDF from the photos even if you can't create the PDF, you can actually still upload the pic itself. Okay, so I'm going to go down the line and I'm going to ask if anyone has any questions. Gustavo.
Yes, so...
Hi, I heard a voice, but I don't yet know who's speaking.
Oh, it was me. So, for that file you have open right there, how can we write on that file?
You have to print it up.
Okay.
Okay, and for those of you who don't have a printer, the only thing, unfortunately, because this is the only format we have, and there's nobody currently available that can actually convert this file to a writable PDF. If you can't print this, fill it out, take a picture of it, and upload it, then the only thing that you can do is to make a Word document with these fields and indicate the fields that are required. For example, the patient name, write the name. Sex, write the gender. Address, write the address out. That is the only, unfortunately, I think that's the only alternative we have right now with the resources that we have available. Did I answer your question? I'm not sure who answered the question because I still was not able to see you. Who was that? Who asked the question? Anybody? Did anybody who just asked the question of
Ashley answered the question.
Ashley, okay, thank you. Ashley, did that answer your question?
Yeah, it did.
Okay, good. Does anybody else have any questions?
Okay.
Hey, Gustavo, go for it.
When we're doing the codes, when we're inputting the CPT codes or like looking for the codes for like ICD-10, the true code doesn't work.
Okay, so then if that's the case, then really,
I was using it. Yes, I was putting the last.
So this is what you do, and make a note of this. Write this down, and let me make sure I give you. What I'm going to do is find the link, and I'm going to copy and paste it in the chat box. This is a very reliable source for ICD-10 lookups. And give me just a minute.
I'm just curious, for Gustavo, are you going through SimChart when you try to open TrueCode?
Yeah.
Oh, okay, yeah, because that happened to me too. It has like at first it was letting me use it, and then all of a sudden it wasn't loading, and then when I tried to close it and reopen it, and then it gave me like, oh, that I'm not authorized to go to the program anymore.
So I have a question. Do you all have your CPT books and your ICD-10 books? Find it in that. I mean, at this point, I'm giving you an easy way to find these, but in reality, you should practice finding codes. Now, the CPT codes are already there for you on the fee schedule, but as far as the diagnostic codes, you can practice looking them up. Okay, anybody need any help looking up ICD-10 codes? Anybody? Okay, so let me just make sure I can find this for you. Bear with me. And this will be an easy tool, but in actuality, it'll give you a good opportunity to this is it. I got it. Yeah, this is a really good link, and it might be a good idea for everyone to utilize this link. I'm going to actually put it in the chat box now to everybody. This makes it easy, but in lieu of this, so you can copy and paste this onto a document. And for those new students who are looking at this recording, I'm going to include this link with the other information that I send you from the orientation, so don't worry about it. Okay? All right, so let's look at what else you have to. Any questions about this?
I had a question. So what if we don't have the physical book and we just have it online?
If you don't have the actual diagnostic code book?
No, the Fortney's.
Oh.
And then I try to look at the documents that you just showed us, and none of them are showing up on the online version.
So the only document, you mean the fee schedule and all of that? Or
the Fortney's book, the 14th edition.
So we have the 15th edition.
I just have
You just have the 14th edition online, right? Okay, so I'm going to have to make a note, and what I'm going to have to do. What's your name? Is that you, Charlene? Hi. Okay. Charlene. And what's your Mercado?
MERCADO.
Okay, got it. So this is what I'm going to have to do, Charlene, for you. I have an online version that will allow me to print some pages up. If it doesn't, then there are two things that are going to happen. I'm going to have to contact my manager to give you access, to see if you can get access to these documents in the event that I can't create them for you. And if that is the case, you'll be given more time to finish your work. Okay? Sorry about that. Okay, any other questions or issues that are similar to what Charlene is facing? And I just make a note, Charlene, you're going to have to give me like the weekend to get this negotiated because it's Friday now. Okay? All right. Any other questions? Okay, so let's move on. And what time is it? I'm going to get you out of here really quickly. So this is the scenario that we have. I'm going to go back and show you some other things about session 1 that are a little bit different, only in the sense that it involves more work. And where it's going to involve more work is that you actually have a lot more reports to code. So for this session, oh, by the way, as usual, there are some, please note the report coding tips and utilize that document for an overview of how to approach coding reports. It's very succinct, but if you use it, by the time you finish the externship, you'll feel comfortable and have a higher level of confidence when you approach these reports, because they can be very intimidating. And quite honestly, the level of expertise for coding these reports, I would say, is at intermediate to advanced. They're not easy reports to code, but you can't lose by trying. And as long as you make the effort, you get credit for it. Also notice here that I have embedded here a recording that I suggest you view on evaluation and management leveling. Now, some of you have learned about this. It depends on the teacher you have. All teachers don't teach it in detail, But if you look at this video going forward, you will understand more about leveling, evaluation, and management. In addition, there's an audit form here that you should have available to look at when you're looking at this video. It helps you, and rather than randomly guessing at what you would come up with for these evaluation and management reports that you're coding, rather than randomly guessing, you will understand the current system used. It will no longer be in effect beginning in 2021, but for all intents and purposes for what you're doing now, there's a special way that you code evaluation and management that involves the use of, for lack of a better term, of an audit sheet, which is the same as using a rubric for coming up with the specific level of evaluation and management that you're going to be coding. And in a minute, it'll show up. I'm going to give it a minute. Here it comes. This is a blank audit form. Thumbs up if you've seen one of these. So, oh, good. Yay, Charlene. I bet this is Charlene. Is this going to be fun for you? Yeah. Did you have Miss Connie?
Yes, I did.
Yeah, Miss Connie teaches this. So you're familiar with this, right? So I'm not going to be able to do everything for this audit sheet, but the recording will. So look at the recording, get familiar with this form. This actually gives you a method for coming up with the level of evaluation and management that you're going to be choosing. 99201, 99202, 99203, etc. Okay, or 99211, 2, 3, 4. These are called levels. The higher the level, the more they're worth, because it means that it took more time and resources and expertise to come up with how you're going to treat the patient, the assessment for the patient. And these, again, you'll understand more about this when you look at the video, but also write this down. Refer to Chapter 11 of Step-by-Step Coding for a refresher on evaluation and management coding. Okay? Let's see, and I'm just so that I don't keep you here. The only thing that I have to point out here is that your evaluation and management assignments, as usual, are within the box themselves. And these are all the ones that you have to do for evaluation and management. As you can see, there are 4 reports. So you might want to get busy on doing these. There are 4 reports per assignment. And if I go back to session 1, you'll see that there are actually, and of these reports, I'm guessing, I haven't done them all, but typically evaluation and management is the one that is going to use most of your brain. They're fun to do. I really like evaluation and management. Once I got the hang of it, I enjoyed doing it more than anything. The rest of the reports that are in anesthesia, make sure that you read the anesthesia guidelines in your CPT manual and refer to the anesthesia coding chapter in your step-by-step coding book to understand how to approach these. Cardiology module, integumentary module, these are in your surgery section, and again, refer to your surgery section guidelines and read the guidelines in your CPT that precede the actual code selection before, in order to refresh your memory. But my suggestion would be to go through Chapter 11 for evaluation management of step-by-step coding. Go to the anesthesia chapter in step-by-step coding, which I don't know what it is right now offhand, but also the surgery section of the step-by-step coding textbook. Refresh your mind on how to approach some of these. Last but not least, review the report coding tips document here. I'll briefly open it up. I got this directly from the AAPC website.
I have a quick question.
Yes, go for it.
Where can I find that assignment to, like in what book or what link?
I'm sorry, say that again.
Where can I find the assignment 1 and those assignments at? Where are those located at?
Where can you find them? Did you just come
Yeah.
on board? Did you just join us?
No, I've been here the whole time.
Oh, okay. So where you find them is actually in the box. All right. So if you click on the box, I already clicked on evaluation and management, but if you click on the drop box, the assignments are right there. You mean, is that, I don't think I answered your question. You mean, what are they, right? Okay, I understand what you're asking now. I get it. So where they are is actually in your Evolve website, Integrated Coding Internship. And this is, it's going to be kind of slow going right here, mainly because I have a lot of windows open and I'm recording. But find these assignments for all the reports that you do, and the assignments are found on the platform, on your Evolve platform. Come on, let me in. And the simulated coding internship. Did you get a chance? Did I send you a link to the YouTube video, Connie?
I'm not exactly sure.
I probably did, because all the people, you attended orientation last week, right? Right, so all the new students, I sent a link to the YouTube video. And if you check your email from last week, and if you pull that up and if you have any questions, you can just kind of review that YouTube video, okay? But where you find the reports is in the simulated medical coding internship. Okay, did you check with your instructor to make sure she kept you in that course?
We didn't do that course. I don't believe so. Not the bugs.
You didn't do the internship, huh? Okay, so this is going to be, what school did you go to? Glendale?
West Covina.
Okay. This is part of the curriculum. So what this means is that if you did not do the internship, I'm going to stop recording, pause the recording for a minute. Does this look familiar, Connie? No, okay. Did you check with your instructor to see if they could keep you on the roster for the internship?
Since I was inside the sim chart once, I was able to get in. I didn't ask her.
Oh, you should ask her to keep to add you to the roster, because you're going to need this to complete the assignments, especially for session 1, because session 1 has 16 reports that you have to do. And we might have to schedule a session so I can walk you through that. But in the meantime, look at the video that I pointed to that talks about evaluation and management coding. These are where the modules are. So when it indicates in your assignment, and I'm going to have to end the session very soon, for example, anesthesia module, and it points to and it indicates the reports that you do. Within the internship itself, you would go to the anesthesia module, and you would actually code the designated reports. In this case, the designated reports are 4, 8, 19, and 26. And here they are, 4, 8, 19, and then there's another one, 26. And you would pull these reports up. You don't code the report itself, but you actually code the anesthesia for the report. And if all this is a haze and foggy, the only suggestion I have that I can offer right now, other than offering you and anyone else who needs it, we can all get together and decide a good date and time to do this as soon as possible. If this doesn't seem clear to you, the only suggestion I can offer you really quickly is to reference in session 1, reference the document that I have on report coding tips. But in addition, as I mentioned before, take your step-by-step coding book out and look at the anesthesia chapter, look at the index, and see review how to code anesthesia, review how to code surgery, and review how to code evaluation and management. that's the best that I can do in the short run. But if you need more help in the long run, I'm glad to set up a session with you. I just need to know. Okay? Okay. Ladies and gentlemen, unless there are any further questions right now, that concludes the session for today. Does anybody have any questions, or do you need any clarification on anything that I've covered? Okay. Everybody's doing a good job. How you doing, Fernando?
I actually have the same issue that Connie has. I never had access to the online internship through Bucks. I had Bucks step by step, but I'm working with the school to get it to get access to it right now.
Okay, that's good. We had Jackie didn't have access either, so I'm glad you're working through the school. I'm going to talk to my manager. Was it Stephanie? Charlene is the one that didn't have access, right? Or Connie? Is it that you didn't have access to it, or you never did it?
I think it might be both.
Okay, so I'm gonna contact my manager on behalf of both of you. Let me just write this down. So that'd be Charlene, Connie, and Fernando. Okay. Okay. So we'll work it out. They worked it out for Jackie, and it didn't take long at all. And again, if this delays you starting the work, you can turn your work in late. All right? Shouldn't be a problem. Thanks, everybody. You're doing a great job. I'm going to stop recording now.